Welcome to Neonatal Resuscitation and Apnea Management, Protocols, Practice and Clinical Confidence. This CPD-certified course is designed for nurses and neonatal healthcare professionals involved in the immediate care of newborns. Who should take this course? This course is designed for registered nurses, midwives, NICU and pediatric healthcare staff, clinical educators and rural health workers. Why this course matters. You'll learn how to recognize and respond to newborn breathing difficulties, apply NRP protocols and APJAR scoring accurately, and use essential tools like the NeoPuff resuscitator, all while building clinical confidence through practical scenarios. Course objectives. By the end of this course, you will be able to describe key physiological changes after birth, apply the NRP resuscitation steps confidently, interpret APGAR scores to guide clinical decisions, recognize and manage the types of apnea, and operate the NeoPuff and T-piece resuscitator safely. Course overview. Modules covered in this course include neonatal physiology and transition, NRP algorithm, APJR assessment, apnea types and management, equipment, specifically the NeoPuff and T-piece, and clinical scenario and decision-making. Neonatal physiology. In this module, you'll learn how blood circulation changes after birth, how lung fluid is cleared and oxygen exchange begins, what happens in the first 60 seconds of life, also known as the golden minute, and why this phase is critical for newborn survival. The golden minute. The first 60 seconds are crucial for survival. During this time, focus is placed on warmth, airway, and breathing. Timely intervention during the golden minute can significantly impact long-term outcomes. NRP algorithm overview. This module covers updated NRP steps based on Australia's 2021 to 2023 guidelines. You'll learn how to conduct the initial assessment by checking warmth, positioning, and breathing. We'll also explore when to apply positive pressure ventilation, when chest compressions are needed, and how and when to use medications. You'll also learn how to recognize when escalation of care is necessary. NRP. Initial assessment. The initial assessment begins with providing warmth, drying and wrapping the newborn. Next, position the baby's head in a neutral or sniffing position. Clear the airway if needed using gentle suction. Then, stimulate the baby and observe for spontaneous breathing or crying. Positive pressure ventilation. This module explains the indications for using positive pressure ventilation. You'll learn how to deliver effective ventilation and understand key techniques and equipment settings to ensure safe and effective intervention. Chest compressions and medications. In this section, you'll learn when to start chest compressions, the correct compression technique and rhythm, and how and when to administer medications during neonatal resuscitation. APGAR score overview. This module introduces the APGAR score, what it stands for, when to score the baby, and why it matters. You'll also explore how to interpret the scores and how they guide clinical decisions. APGAR, the 5 criteria. The 5 criteria assessed in the APGAR score are appearance, which refers to the baby's skin color, pulse or heart rate, grimace, meaning reflex irritability, activity, which indicates muscle tone, and respiration or breathing effort. APGAR, clinical decisions. A score of 7 to 10 is considered normal. 4 to 6 indicates moderate distress. A score between 0 and 3 reflects severe distress. Each range guides when and how to escalate care. What is apnoea? This module explains the 3 types of apnoea in newborns. Central apnea occurs when the brain doesn't send the signal to breathe. Obstructive apnea happens when the airway is blocked. Mixed apnea is a combination of both central and obstructive types. Apnoea. Risk factors. Risk factors for apnea include premature birth, infection, birth trauma, low birth weight, and neurological immaturity. Recognition and immediate actions. Apnea is recognized by signs such as pauses in breathing, cyanosis, and bradycardia. Monitoring includes apnea monitors and pulse oximetry. Immediate interventions may involve gentle stimulation, oxygen administration, or caffeine therapy. What is a neopuff? The neopuff is a T-piece resuscitator used in neonatal care. It delivers consistent pressure during ventilation and is considered safer than a traditional bag mask in many cases. Neopuff. How to use. To use the neopuff, set the PIP peak inspiratory pressure, PEEP positive end expiratory pressure, and flow rate. Ensure a secure mask seal over the newborn's nose and mouth. Observe for adequate chest rise and monitor vital signs like heart rate and oxygen saturation. Adjust settings as needed for effective ventilation. In emergency settings, stay calm and follow your local protocol. Most neopuff units have preset guidelines. Knowing your specific model ahead of time can save lives. Tips and troubleshooting. Before use, check for air leaks, disconnected tubing, or incorrect pressure settings. Always clean, test, and assemble the neopuff before placing it at the bedside. Ensure oxygen flow is working and pressure readings are accurate. If the baby is not improving, reassess the airway and equipment. Know when to escalate care. Delays can be life-threatening. Keep a quick reference checklist and regularly run simulation drills to stay prepared. Clinical scenario. Example. A baby is born at 35 weeks with no cry. The care team performs a step-by-step assessment, applies PPV using the neopuff, and scores the baby using the APGAR system. Based on the baby's response, they follow the decision-making pathway and escalate care if needed. Summary. By the end of this course, you can respond effectively in the first minutes of life, apply the NRP algorithm and APGAR score correctly, manage apnea confidently, and use neonatal resuscitation equipment safely. Thank you, and next steps. Complete the quiz to test your understanding, download your CPD certificate once finished, and apply these skills with confidence in your clinical practice.